You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, cosmetic dentures, affordable cosmetic dentures. My first guest is an expert on this topic. He is known for implant dentistry and also cosmetic dentistry. He's here today to talk about cosmetic dentures, Dr. Shawn Keller. Dr. Keller, welcome to the program.
Glad to be here.
All right, now, before we get into today's topic, and I know you brought a lot of photos, for people that don't know your practice, like who's the typical patient and what are the different services you offer?
Well, people can come to me for something as simple as whitening their teeth, or if they want to improve their smile, we can do smile designs and do a custom make your smile look better. People can come to me for bite problems. If you're getting headaches or migraines, or you've been told that your bite doesn't fit quite right, they come to me for that. If you're missing a tooth or a few teeth, you can avoid a bridge and we can do a dental implant. We'll also have people in for metal-free implants. We're one of the only places around that offer the zirconia ceramic implant. Very healthy option when you're missing a tooth or a few teeth. We can place those in on the same day, which is one of the things people really like, is we can have the tooth out and place the implant in place. We use platelet-rich therapy, or sometimes called stem cell therapy, to help that heal even faster, help grow you some bone. And then one of the other things we do is a lot of people have dentures. A third of the population over age 65 is in dentures.
Are there a lot of people like in Seattle with dentures?
Yeah, there's a ton of people, about a third of the people that are older, and they think that that's their only option, is just dentures. Their teeth are out, the game's over. And what we find is there's a new technology out there that we can make them a way better fitting and a very attractive denture. It lets you eat a lot more foods that you normally couldn't eat. Salad with cucumbers in it.
Okay.
And also it supports your face a lot better, so it can make you look a little bit younger when you put it in too.
Now, I told you, I always feel like I could spot a denture from 10 feet, 10 yards away. You said not these dentures.
Yeah.
So they've come a long way, these cosmetic dentures?
Yeah, they have. There's some new technologies that they look very, very natural, and with some of the way that we use our computer technology to balance them and how they fit, they stay in a lot better than the regular dentures too. So we can make them in different positions, so they look very natural. They make you look younger, and you can eat more foods than you can with a regular denture.
Okay, and they're affordable.
They're more than the regular economy dentures, but they're very affordable. We do a lot of porcelain veneers in our office too, a lot of smile design. Been doing that for 20 years there. We can do as few as just a couple teeth and blend it with what you have. You can do just the ones that show, or some people choose to go for like a full rejuvenation. And if we do the chewing surfaces, we can get some changes in your face that can be dramatic too.
Okay, now you have this concept, and help me if I make sure I get this right, but you pretty much do everything right there. Like you have your own laboratory where you make the teeth right there on site. In fact, you have like wands that go in their mouth instead of the goop, so you can do like impressions digitally. It's all planned on the computer these days. Is that right?
Yeah, I mean, it's awesome. It's so exciting to come to work. I feel like a kid in a toy store. The downstairs we have the clinic where we see our patients, and then upstairs is our own dental laboratory. So this isn't the old CEREC where you scan one tooth and you make the crown that day. We can do the full set ourselves. We don't have to take the impressions. If you've ever had the impression taken before, where you gag on the goof and they pull it out and you get an impression of your stomach, we do it all with this wand now. We just scan your teeth and we have a 3D image of your tooth right there. And you see it on the computer. I'm still amazed by it when I look at it. Okay. So cool. And then we have 3D printers. We can print the models. We have milling machines.
You can actually print and make a tooth model.
Yeah.
In your office.
Yeah, it's
from
really
a printer.
I mean, I still don't even know how it works. There's just like this liquid acrylic, and it dips down and pulls this thing out. What? Yeah, and I'm like, it's awesome.
Now we should mention that you have trained, I guess, at this Las Vegas Institute, where dentists from all over the world go. How does this help you with cosmetic dentures? Is there a connection there?
Yeah, so this is where we learned the technique. Traditional dentures, we know their limitations. They don't look very nice, and they don't fit very well. Also, as you lose bone over the years, they fit worse and worse. So they pop out whenever you try to eat anything hard, and they're not very stable. With these dentures, the way they fit, we pay attention to the muscles of the face and the way your bite works, so we can do a lot more with them than you can. They fit better. They're made of much better materials. Instead of just having the old acrylic that wears flat and kind of turns darker, we actually use porcelain teeth on them. They look very, very natural, and they fit way better. So when you wear these dentures, you can eat more foods. You can start eating salad again. You can chew harder things that are crisp. Basically, when you have a poor fitting denture, the unhealthy foods are soft and pasty and sugary. If you want to start eating healthy so you can feel better, the healthy foods are crunchy and crisp, and these dentures will help you do that. Enjoy some of the foods.
So you're sold on them. I mean, because we talked on the phone. And even though I know you do a lot of other things in your practice, but like you say, not everybody could afford dental implants, not everybody could afford getting a fixed set of teeth, all with dental implants, and some people have to go with a cosmetic denture, as you're calling it. But they do work, right?
They work.
You could eat with them.
They work really well. You can eat a lot of foods that you couldn't eat before. In some cases, if you want some extra security, we've got a snap-in option that we can do, and we can do some things to secure them even better. Okay. And so, it's good to come in and see what kind is best for you.
Now, you brought some photos.
Yeah, we have some patients that we've done, and then some other patients that have been done with this technique. Okay, so this is Rob, and we have a lot of testimonials on the internet of just people we've made happy over the years, and he found us from Alaska. So he calls and tells us about his story, and I wound up doing a FaceTime with him on our iPhones, and he kind of showed me his teeth and showed me what he was working with, and oh, poor guy. I can't imagine that he didn't live at the dentist with the way every tooth was broken or had decay on it, and he's telling me he's just always in pain, and he's just always going to the dentist, and it's just a never-ending battle. As soon as one gets fixed, then it's time every time he goes in, there's something else wrong, and he's just tired of it, and he doesn't know what to do. He didn't know what we had to offer, but he just figured he was done with having problems. And so I told him to come on down, and we figured out a way to have him fly in and come up with a plan and take care of it in just a couple days. Having the lab on site is really nice to allow people from out of the state.
So what did you do for him?
So he comes in, and we looked, and trying to save the teeth that were there, the never-ending battle would have continued. So we decided to have his teeth out and have the facelift denture put in that day. And
you call it a facelift denture, why? Just because it makes you look younger?
Yeah, well, when you put it in, because of the way it fits, it makes some changes in your face that regular dentures can't do. You kind of get a little shorter from here to here, and generally your lips aren't supported the way they can, so you kind of get this flat aged look, and when we put this in, it kind of just gives you that youthful look again.
All right.
So he flies down, makes the appointment, he flies down. The first day we meet him, take all the necessary x-rays, come up with a plan. We have the day blocked out the next day to do it. So we have the teeth out. We use the stem cell platelet-rich therapy. Basically draws blood, spin it, and we concentrate all the good stuff from it. So he has all these teeth out, and he has no pain. It just heals up really fast.
Or very little pain, we should say.
Yeah, very, very little pain. Like
okay.
He was expecting, we said on a scale of 1 to 10, what do you expect? And he's like, it's going to be a 20, but I'm ready for it. That'll be worth it to get out of this. Next day, he says it's about a 1. And he's just taking,
nice.
Yeah, ibuprofen's all he's taking. And I attribute that to the platelet factors. When we put that in there, it just makes it heal really, really fast. So then we have then we put the facelift denture in right there, and instantly he's already looking younger.
Yeah, let's take a look here.
Yeah,
yeah, looks nice, very nice.
Yeah. I mean, it's for him. He's so happy. We kind of work on the look of it. Like right when it goes in, if we don't like everything we see, we've got the lab right there, so we can make any changes. So I've got a pretty good eye for looking at this and seeing what looks good for people. So we put that in, and he's doing great. He's starting to eat food again. Before his teeth, he's afraid to smile. He doesn't like the way they look, so it was difficult enough to get that picture of him smiling. And he doesn't show anybody else's teeth, so everyone else just thinks he's a grumpy goo no matter where he goes. And
yeah.
You can't imagine what kind of effect that has on your life. So we put this in, and the first time he smiled, he doesn't even really quite know how to yet, but I thought it still looked great. But then he's come back in a couple months later, and it looks amazing. He's talking, he's speaking. He's a different person. The way he acts, the way he's comes in and hugs all my team there, and he's just lit up. It looks like a different guy. His eyes look healthier. Just having all those infected teeth in there must have been poisoning him, and he just. It's just
he
really
does
changed
look
his life.
younger. I mean, there's no doubt about that.
Yeah,
I'm not trying to side with you, but I think he does look younger.
And he's lost. And then this picture is right after we did it. I mean, I've seen him since then. He's lost some weight. He's eating healthier now. When you don't like your teeth, you're pretty much eating pasty things. It's all high sugar, high carbs, and that's not very good for you. when you get, your mouth doesn't hurt anymore and you can chew again, you can start eating those healthy, crispier foods, and it's not such a battle to get it down. So it's generally going to be a whole body thing. This is another lady. This is actually, this is the Fountain of Youth denture. So she came in and she basically just, once you get your denture, you think that's all you can have, and they start popping loose sometimes when you try to eat certain things, and so they have to shorten them. And
so those are a denture, what I'm looking for right there.
Yeah, so she started with just kind of your regular denture. You know, you had your teeth out and you were given your denture, and you think that's okay, well, that's what I got now. And you're not really, you don't hear about your options. Well, there's something way better now. So look on the before denture. This is how typical dentures are made. The smile of the lower lip, it doesn't follow the teeth. The teeth is kind of like in a frown shape, and the bottom lip is going up. They don't follow each other. And you kind of have to do that or the denture pops out the way those are made. They have to make them shorter so there's no leverage. When we design these, we use the computer, and using these techniques we learned at LVI, we can make it stay better. So we want the teeth to be longer and follow that bottom lip, kind of look like beautiful natural teeth rather than the denture teeth. Now take a look at the after. You can
Very nice. And that's a denture.
Yeah, that's the denture. That's the facelift denture in, and we put that in after we made it digitally. So we scan the face, we scan the arches, no impressions, made it up in our laboratory with our milling machines, make the teeth separately, and that goes in, and then there she goes. But let's talk about what it's done for her appearance. Look at that. Look at the first denture. The canines aren't sharp, and the length of the teeth. Look at the new one. Look at the way she smiles. The teeth flow with her lip. It's beautiful. That's by design. Look at her canines. They're sharp and pointed like a regular canine. Look at the gum line there. Everything about these dentures is higher quality and meant to flow with her face and function with the way that she chews. Now look at her face. Look at the overall appearance. Would you say in the after that she looks younger?
Yeah, okay, I'll give you that. It almost looks like the maybe younger sister of the first one.
Yeah, I'd say so too. And then once people get this in and they start feeling the confidence, they start acting different too. They start acting about like the way they used to when they were younger.
What do you mean by that?
Well, they're not afraid to smile anymore. Sometimes when you don't like the way your teeth look, you don't smile very much, or when you do, you kind of reserve it a little bit. And when these people, when we see them, once they get used to it and they start smiling again more, they're just generally like a happier person. Well, let me show you this other patient. So he came to us, and again,
let's take a look.
He's heard about what we do. He doesn't know exactly what we do, but he's heard that like you want to hear your options. So he comes to us, and he's got half the teeth are already missing, and the ones that are there can't be saved. Like it'd just be expensive and a lot to go through, and they probably still wouldn't last. So he's one we can do, and we talk about the facelift denture, and he's a great candidate for it. We can't even get him to smile. Like, he just seems like the most grumpy down person. I thought he was mean at first. I had no idea, because he's sitting there, and eventually the only way we got this picture is we were taking a video and we had to get him to laugh at something, and we took the picture from the video, so we can kind of follow the shape of his lip there. So again, we had the teeth out. We made the cosmetic facelift denture for him. Yeah, but look at the after. Look at that smile. It's like, I mean,
nice.
And that's just natural. He just comes in and we asked him to smile, and he can do it now. So that once it goes in, we do a lot of things to make it flow with the face. We can make the teeth look natural, the way they were meant to when you were younger. They don't have to be the shortened version that they put in these in the regular dentures. Again, they stay in so bad. The other kinds stay in so bad, we have to shorten the teeth and put them back further over.
So traditional dentures, you were telling me in the green room, they're made differently than these cosmetic dentures.
Absolutely. When the teeth are out, the little ridge that's left is further back, so you have to kind of put the teeth over that for balance. And those teeth are shorter and they're further back, allowing the face to collapse.
So the face sinks in a little bit.
Yeah, and that's the only way you can have the teeth, so that you can still remotely chew anything.
Do they
with
have
them.
any say-so in like what their teeth are going to look like? I mean, do they ever point and say, I like that?
Well, we show them digitally first, and we'll play with it and show what they like, because we can pretty much do anything. We have a simulator, and we'll be able to do it digitally first, and then we try it in too. Like you can do everything on the computer first, and then when you try it in, you might notice in one of your laughs you show more on this side, and we just want to make sure that it looks perfect from all angles, and then let you try it out. And there'll be another visit later where we make sure that everything's feeling great and perfect. So it's custom fit just for you, and we use really advanced technology to make sure that it's going to last a long time, and it's going to be comfortable, and that you can chew the foods that you should be able to.
You say that people hold on to their dentures too long. Elaborate on that.
Well, regular dentures are made out of acrylic, and so they're intended to last 5 years or so. And they're generally, acrylic is wearing down in your mouth. It's kind of made out of a bit of a porous material, so it kind of gets this odor after a while. And as the bone changes, they become more and more loose fitting, but you don't really notice it because it's just happening slowly. And so I've seen people hold on them for 7, 10 years.
I know somebody 20 years. I was asking them because you were coming on the show, like 20 years a denture.
Yeah, and it was just kind of like the frog in boiling water thing. They just didn't notice as it was just getting worse and worse and worse. And so then they think, well, maybe it's time to replace it, and they'll go to Mexico to try to save a few bucks. And you wind up with something similar to the first one you have, just like a little bit newer plastic. Technology's come a long way, and if you find the right dentist that does it, like this is also my friend in Savannah did this case. And
let's take a look.
Yeah, and it's
and this is more of a sample. It's not your patient, but a sample of what teeth can do to your appearance.
Yeah.
Is that right? Okay.
And it's the same.
And these are dentures.
Yes, and it's the same technique, the facelift denture. And when you put it in, it instantly her face looks younger because it's just a different height, right? Like if you that look where you take your denture out and you can put your chin to your nose. Well, if you've got a denture,
she kind of looks like that on the before.
Yeah,
like sunk in a little bit.
I mean, it's like these dentures, like they're made way short. They have to make them like because they don't stay in very well. So if they're shorter, they can stay in better, and you don't really notice that you look that much older from the shorter face. Well, when we put these new ones in, because of the way we do them, we can make them the ideal height. So instantly, it's just like putting the short denture in makes you look a little better. Putting this one in makes you look a lot better.
So on the after, her nose and her chin are farther apart, it almost seems like.
Yes, yeah.
Is that an illusion or it actually is happening?
That's actually happening. I was watching The Simpsons the other day, and I'm looking at the characters, and when they draw the grandpa and all the older people, I was thinking, what do they do to make them look old? And the main thing that they do is they draw these lines right here, and they make them really short from the nose to the chin.
Like her in the before, like her before photo.
Yeah, and so I think, short dentures. So what if we just put ones in that are the height that our teeth used to be? It does big changes for your face.
So it's kind of like this facelift denture, because when you first said facelift denture to me over the phone, it sounds like a total exaggeration or gimmicky or whatever.
Yeah, I mean
but you say it because they look different, and I think anybody looking at this photo can see she looks different.
Maybe jaw repositioning denture would be a more accurate term, but what it does is it just kind of lowers the jawbone and the skin tightens up that way. It relaxes the muscles because your muscles aren't strained trying to manipulate these plates the way you used to be. You kind of get this relaxed look because it's balanced so well. Everything's designed with the computer, and since it's so accurate to do it all digitally, we can do things that you can't normally do with a regular denture. The regular dentures, you have to make the teeth shorter, and oftentimes they don't flow with the face well. With these, we can make them look ideal, and so they can flow with your bottom lip, and they can be out further where they were meant to be so you can see them. It's you don't want to go out too far, right? Like we'll play with it until it looks perfect. But we can do things that you can't do with regular dentures.
And you do everything, right there in-house, right? You have your own lab. You even have one of these digital machines that makes teeth. Like a digital printer that makes the teeth.
Yeah, we've got 3D printers, digital printers. We've got milling machines. We've got the latest technology we have there, and we've designed our practice specifically around doing this type of procedure. So when you come in there, we don't have to send you out to different specialists, and then you don't know what the fee is there, and then there's the wait time to get in there. We don't have to send things out to the lab anymore and wait for that. It's very efficient, and it's designed specifically for this full mouth type of procedure. So here's another patient who had the facelift denture. So look at the before there. Her top denture had to fit with her lower teeth the way they were. You can barely see the teeth. They're kind of at a slant there, but it had to be like that to fit with her bite the way it was. So when we diagnose the bite and use our technology, look at the after there. Her teeth are, it flows with her bottom lip. Her teeth can be a little bit longer, so they actually show when she smiles. When you smile really big, you should show your teeth. They should flow with your bottom lip, and it should have some width in the back. It shouldn't just disappear after your front teeth. And hers does that now. Most people don't know that she has a denture.
Are you a perfectionist?
I'd say almost to a fault.
Okay. By the way, I saw your artwork. If anybody goes, is that artwork on your website? You are like an incredible painter. Right?
Yeah,
Is that what you're called? Artist.
Yeah, I didn't really go to school for it. I've for so many years I've been when we make our own smiles, we'll be staining and glazing the porcelain, and I didn't realize I was learning a lot about color then. And then I was just bored one summer and took one of those have a glass of wine and paint on the canvas thing, and I realized, wow, you know, I must have got pretty good at this over the few years. So I've been doing a lot of painting in my spare time, and I mean, just love the artistry.
I wish I could show it on the show, because it really, we're not just saying, I mean, this is really incredible artwork. Okay, so you bring this into the teeth. It has a lot to do with the teeth.
I mean, yeah, I like creating, I like making things beautiful. And so when I get into a smile, it's just not about like, you know, does it hurt? Can you chew? See you later. I mean, I want this to be beautiful. I want it to flow with your face. Everyone is different.
Okay.
There's not just one cookie cutter shape that you can put in. It has to flow with their face. You have to see the way they smile and which muscles and how far up it goes. They have to speak with it. Like this is a person, and this is one of the more important things in their life. This is how you eat. This is how you smile. This is how you let another human know that you accept them and that you're connecting with them. Is how you smile. And if you don't like your teeth and it doesn't fit well, I mean, you're not going to be your real self. It's amazing the transformation that takes place. I had this one woman, and this isn't the only one like this, where once we've got it ready and we sit them up and we hand them the mirror, I mean, a lot of times it's just tears. They're just so happy. Sometimes they don't, like, they put their hand over their eyes and I'm like, oh.
They don't even want to see it.
Yeah, and I'm like, oh crap, do they not like the color? And they're just like, they come up and they say, just after a lifetime of just pain and not liking it, and they just jump up and hug us. It's amazing. It makes all the hard work worth it to be able to do that for somebody.
Okay, hold that thought. We're going to take a quick break. We come back, and also after the break, I'm going to have to rush you through some of the photos so we can get as many in as possible.
Okay.
You're watching the Wellness Hour. We're talking about cosmetic dentures today with Dr. Keller. We'll be right back.
Hi, I'm Dr. Shawn Keller, and I'd like to talk to you about rejuvenating dentistry. A lot of people don't know that your back teeth support the shape of your chin and your front teeth support your lips. So with small, precise changes on the back teeth, we can make big changes in your face. Many people, as the teeth have worn down, it can make you look like you've got a double chin, or it can make your jaw muscles pop out. And with some simple dental procedures, we can thin out the cheeks, making your cheekbones look bigger, and bring your chin forward and suck up that double chin look. So call us today for your complimentary consultation to learn more about how you can look younger at the dentist.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, cosmetic dentures. With us, we have an expert on the topic, Dr. Shawn Keller. Now, people know you. You're on TV a lot, we're in Seattle. Is that right? Like on one of the morning shows?
Yeah. We've usually got something new and high tech that we're talking about, and it's kind of fancy and fun to talk about. This facelift denture technique, using the computer to digitally design things and using our technology to get things balanced, it's not just used for the dentures. We use the same concept in all the smiles we design. So whether you've got teeth that are going bad and we need to do the denture in that shape, or your teeth are in good shape, the roots, and they just need something like a veneer on top of it to make the outside shape better, we can use it for that. Or if you're getting dental implants, the bridge that we design, we use the same technique for that. So we'll get these facial changes and the same passion that goes into designing the smile with all of these. Here's a patient. This is actually one of my main team members' husband. So Nina had seen us doing this on enough people that she's like, you know, I got to get my husband in there and get him worked on. So Greg comes into me, and I mean, he doesn't like his smile, but I want you to look at his smile there. So that's the definition of an aged smile. The teeth have been worn flat, so the smile doesn't follow the curve. And I want you to look at the after now. He doesn't even know what we were going to do for him. He was looking for some improvements, and he'd heard a few things. He didn't know what we were going to do.
Because one of your employees, this is the husband.
Yeah. He didn't even know if
so you thought this is going to be great.
Yeah,
when you saw him.
I mean, right when I saw him, I knew the changes were going to happen. It wasn't just going to be a tooth color thing, or they're going to make the teeth are going to look a little whiter. I knew it was going to change his face. I knew it was going to change the way he acted. And as soon as we got these in, and again, he's just a different person. He's smiling bigger. He's proud of his smile. He's more confident. It's awesome, and she's so happy that she brought him in. But look what it's done to his appearance. Would you say that he looks more refined, more sophisticated?
Yeah. Okay. I'll give you that for sure. And so, so the teeth look real. So you designed everything there. So to the denture words, and we literally are out of time. And I know you have more photos.
Yeah.
But for people out there with their old denture, or maybe they have teeth that are just about to be taken out, right? You can't save their teeth. What's your message to them? They're watching this, but they're afraid of the dentist. Maybe all their teeth have to come out. Maybe they can't afford dental implants, right? Because I know you do a lot of those.
Yeah.
What do you say to them about these cosmetic or facelift dentures that you call them?
Well, I would say that this is something that eventually you're going to need to do. You have to do it for yourself. And I've been here a long time doing this. I love doing it. It's my life's passion. I dedicate all my time to studying this and learning about it. The toys and the technology, it's fun. And the way that we've got this down is we can have you in and we can do it in a very comfortable way. Using the platelets and some of our techniques, we're going to have the discomfort minimalized because we have our own lab. It's really going to look sweet. Like we can take the time right there to make it look perfect. It's going to change your life.
Is that right? Because I mean, look, you're a dentist. You always think dentists think the teeth are the most important thing.
Well, to me, I really think they are, and I think they are. So yeah, it's not the only thing, but it's how we communicate to other people, and it's how we put everything in our body that we're made of. And so,
eating, chewing, all that stuff.
Yeah, and so it's extremely important. And if it's not healthy, sometimes you don't even know all the ways that it's affecting you. And I've been there a long time. We're gonna be there a long time, and we'd love to take care of you.
So you invite them in. Do they all meet with you?
Yeah, so you come in for your initial consult, and in the first day that you're in, I'm gonna pop by and say hi, and see if this is the kind of thing that you want to go through. If everything works out, then I'll be doing the exam, and we'll get started right away.
Fast turnaround time because you do it all in-house.
Yeah, we do it all right there, and we block out specific times every week just for doing this. So usually we can get people in pretty quickly.
So this denture, it's like the next generation of denture. So they fit better.
Yes.
Right? You can eat better with them, and they look
made of better materials. They look a lot better. They're going to last longer. They're not going to cause bone loss as fast as the other dentures. The ill-fitting ones, when they're moving around, you lose the bone faster, and then your option is later.
So these just hug the gums better?
Yeah.
Why do they fit? I mean, we only have 30 seconds left, but they just fit that much better?
It has to do with the digital way that we get our initial scans. We can make them go up in places that hug a lot better than regular dentures. The other ones just don't go in all the places they should, and they create sore spots if they do. And these ones are, it's the digital way we do it.
So it's never too late to have a beautiful smile.
It's never too late.
And these look real. Like if I saw these people in person, I would know they're dentures.
Unless you're in the dentist appointment with them, you can't tell.
Okay, good. I want to thank you for coming on the show. Great stuff.
Oh, it's great to be here.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.